and 95.3 FM.
Who's banged up? Who's in the training room? It's time for the Dr. Lox Sports Injury Report. In pain? Why operate when you can rejuvenate? DrLox.com.
And it's our pleasure this time every week to bring in the good doctor. Dennis Lox joins us now with his injury report. Good morning, doctor. How are you?
Great. How are you guys today?
Doing very well, and I want to start right here. The Tampa Bay Bucs begin their regular season this Sunday against the Tennessee Titans, and their top wide receiver, their star wide receiver, Mike Evans, has not practiced now for a couple of weeks, Dr. Lox. He has what we're being told is a hamstring injury. They kind of indicate that it's not that serious, and yet he hasn't practiced, and the game is Sunday. We've had some hamstrings out there, so now it's very hot. Can the dehydration sort of contribute to these soft tissue injuries, and what are the degrees of difficulty trying to get these things healed?
Well, I'm not so sure it's a dehydration issue. We chatted about Mike a couple weeks ago, and one of the things I talked about was the time back to recovery often is dependent upon how big of a tear it is. And the quick ones that are smaller tears can come back in 2 to 3 weeks. The larger ones, if they're a 70%, 75% tear, usually are closer to 5 to 6 weeks. So it may just indicate that this is just a bigger tear, or sometimes there's multiple areas that are torn in the hamstring. And because receivers put so much stress on it,
right,
it's important to let it really heal completely. So he may just have a slightly larger tear and just have to run a longer course to get him back to full speed.
Dr. Lox, also another talented wide receiver, Victor Cruz from the New York Giants. Right now he's actually suffering from a strain to his left calf, and that's going to probably keep him out of the opener. But he's coming back from a ruptured right patella tendon. Just can you go over some of the details of what goes into coming back from something like that?
Well, sure. The quadriceps is your biggest muscle and inserts onto the kneecap. And then after the kneecap is the patella, and then there's a small tendon that connects the patella to the tibia, which is the shin bone. So either one can be torn. You're above your kneecap or below. This is below the kneecap. In football, it's not one of your more common knee-type injuries, but it can occur. But when that happens, you basically have to sew it back and run it through, usually with sutures to stitch that back together to make it a firm enough structure that it can bear the loads that wide receiver places on their knees. So it's usually a lengthy recovery to reattach that and make it stable enough. And he's going on almost a year, so that's about the right amount of time. Apparently he's been practicing quite well, but he actually believe injured his calf, and that's why he's being out for this right now.
Yeah, is there any relationship between the two, do you think, or no, it's just something totally separate?
It may have absolutely nothing to do with it. What I understand, he was practicing well, no swelling. These types of things, when you tear your quad or your patellar tendon, are very difficult, and so you have to get him back in the game and playing 100% to see how he really holds up. Some of them don't ever come back to 100%, but apparently he's been practicing well, no swelling or any pain, so
right.
It may be not related at all.
Good stuff, Dr. Lox. We'll talk to you next week with another injury report. Thanks so much.
Thank you.
Okay, have a great week. The injury report brought to you by Dr. Lox's Sports and Regenerative Medicine. Want more info? Visit drlox.com. In pain, why operate when you can rejuvenate? drlox.com.